Hello, and welcome to the Apple Health Quarterly Webinar Series on Spenddown, brought to you by the Eligibility, Policy, Innovation, and Community Support Team at the Healthcare Authority. Today, we will cover the following topics. What is a spenddown? Who is eligible for a spenddown? Base periods and calculating a spenddown. Magi Medicaid spenddown letters. Classic Medicaid spenddown letters, how to apply for a spenddown, change in circumstances, spenddown Medicare and Medicare Savings Program, and resources. What is a spenddown? A spenddown is very much like an insurance deductible and is used to determine a client's liability for the cost of their medical care. Medical needy coverage begins once an individual has shown that they have incurred medical expenses that meet their established spend-down liability. A spend-down liability includes medical bills that are incurred or paid during your current base period, medical bills incurred and paid during the 3 months prior to application, and medical bills from any family member that you are financially responsible for who also lives with you. For more information about the scope of services for medically needy Medicaid, you can visit our billing guide at hca.wa.gov. Please note that there is no automatic redetermination process for medically needy process, which means that clients must reapply at the end of their base period or when their certification ends. Who is eligible for a spend-down? Who is eligible for a spend-down? There are two groups of individuals who may be eligible for spend-down. Apple Health Classic Medicaid spend-downs are for those who are age 65 and older, blind, or disabled, who have income above the income limit or resources below $2,000. Apple Health Magi Medicaid spend-downs are for individuals who are pregnant and for children who have income above the income standard. Instead of establishing a spend-down, a client may also elect to purchase a qualified health plan through Washington Health Plan Finder. Base periods and how a spend-down is calculated. The spend-down amount is determined using the client's choice of either a 3 or 6 month base period. The client may receive medical benefits for all or part of the base period, depending on when their spend-down is met. Clients can also request retroactive eligibility for 1 to 3 months prior to the application month to cover bills they incurred before they applied. A 6-month base period is the default, so if clients would like a 3-month base period, they must request this by contacting DSHS. Spend-down liability amount is dependent on the number of people in the household, the countable income in the household, and the medical program for which a client is eligible. With this information, the amount of the spend-down is then determined based on the selected base period, 3 months or 6 months. Allowable expenses for the medically needy program must not be reimbursable by Medicare or any other third-party coverage. Expenses must meet the responsibility of the applicant or recipient. The amount left over after Medicare or other insurance pays is typically the patient's responsibility and can be used and applied to the spend-down liability. For more information about Medicare program coverage and allowable medical expenses, please see the Allowable Medical Expenses chapter chart. Magi Spenddown Letters. When a Magi client applies for Apple Health and are determined to be over income for the program, they are sent a letter that offers them the opportunity to select a spend down. It provides a brief definition of the spend down program and lets them know who to contact if they're interested in applying or enrolling in the spend down. Once a client is active on a spend down, they will receive a letter describing their spend down liability and their base period. Paid or unpaid medical bills that are incurred during the base period can be faxed toll-free to 866-841-2267. Unpaid bills incurred prior to the base period should also be submitted. Medical bills can be for any family member in the household that the applicant is financially responsible for. If the individual doesn't reply to the offer letter, they will receive a spend down denial letter. Once the client is established on the spend down, they will receive a letter that describes their base period, the amount of their liability, the expenses that they will need to submit, and how to submit the medical expenses. This is an example of a Magi spend down established letter that shows the client's eligibility as well as provides information they need throughout this period of their spend down. Once the client has met the financial obligation of the spend down, they will receive a letter that describes their eligibility that contains the total amount of their outstanding medical bills that were applied, the base period, including retroactive periods, and bills that were unable to be used toward the spend down. This is an example of a Magi spend down approval letter. Classic Medicaid spend down letters. Once an individual has established their financial obligation and the spend down is met, the client will receive a letter that describes their eligibility similar to as in the Magi program. This letter also provides information about their base period, including retroactive periods, the amount of their liability, what expenses they need to submit, and where to submit the proof of medical expenses. Once that financial obligation has been met, the client receives the established letter, providing information about their eligibility. This letter contains a comprehensive list of bills that were applied to the spend down, the base period that includes the retroactive periods, and will list bills that were unable to be used toward the spend down. Again, very similar to the way the Magi spend down works. When the individual submits copies of their medical expenses and they've met their spend down, they will then receive the approval letter. And this is an example of a classic spend down approval letter. How to apply for spend down. There are a couple of different options to apply for classic Medicaid spend down for a client who is aged, blind, or disabled and is over income for the program in which they are applying. These application modes include online at washingtonconnection.org. They can submit an application via U.S. mail. There's an option to fax the application, to provide an application in person by visiting a local community services office. Applications may also be submitted by phone. To apply, submit a renewal, or report changes for a Magi Medicaid spend down for children and pregnant individuals, they can apply through WashingtonHealthPlanFinder.org, send an application in via U.S. mail. There is an option to fax this application. It may also be emailed to apple@hca.wa.gov, and phone applications are also accepted. Change in circumstances. When assisting a client with a spend down, you may hear the question, what if my situation changes? There are circumstances if an individual experiences a change in their situation where they may be eligible for a different Apple Health program, they may have a different spend down amount, or their change in circumstance may not have any implication on their health coverage at all. Changes that need to be reported are a residential or mailing address change, change in marital status, an increase or a decrease in income, when family members move out of the residence, pregnancies must be reported, incarceration must be reported, if an individual obtains health insurance coverage, including Medicare eligibility, if an individual receiving classic Medicaid coverage receives resources, or if there's been a change in immigration or citizenship status. Spend Down, Medicare, and the Medicare Savings Programs. Individuals applying for Apple Health should be considered for all programs, and if the individual is Medicare eligible, the Medicare Savings Program, or MSP, should be considered. An individual can receive any of the MSPs while pending a spend down. Once an individual has met their spend down amount, Apple Health can then be opened concurrently to the MSP program, as long as the MSP program is a QMB, which is a qualified Medicare beneficiary that pays Part A and Part B premiums, deductibles, and co-payments except for prescriptions, or they can be enrolled in a specified low-income Medicare beneficiary program, or SLIMB, which pays Part B premiums. Medicare premiums are only allowed as an expense toward meeting spend down liability when HCA is not paying them. The allowable expenses for spend down must not be reimbursable by Medicare or any other third-party coverage. The expenses must be the responsibility of the client. The amount left over is typically the patient responsibility, and that amount is typically applicable toward the spend down liability. Washington Apple Health won't pay for most prescription drugs for individuals entitled to Medicare Part D. The full cost of prescription expenses may not be used to meet the spend down. However, Part D copays and premiums that are paid towards spend down can be used. Resources. We'd like to take this opportunity to provide some helpful resources to you. We do have a provider spend down step-by-step document that's available at hca.wa.gov. We always recommend the use of our cross-agency desk aid, which can help you determine the best customer support center to refer questions and issues to. There are also a couple of Washington administrative codes that we recommend reviewing if you have more questions or need more information about spend down. We would like to thank you for your time today, and we will now open the floor to any questions you may have.